It's the beginning of the pandemic. Factories start closing. There's deaths occurring all throughout Chicagoland and even in the suburbs. And I go on the news talking about asthma and what type of asthma is going to be highest risk for COVID-19 complications. And I go on Spanish TV and suddenly my phone goes absolutely crazy with all these essential workers asking, can she help us? They were the maintenance people in the hospitals, or they were meatpacking companies or grocery stores where all these outbreaks were happening. It was like, what do we do? Who can we turn to if we think we're infected or there's outbreaks in our work, and how do we take care of our family from there? I don't have all the answers at that point. A lot of my friends who have practices started closing, or hospitals made a lot of my colleagues close their practices as well. They said, you have to close, this is our rules, etc. I made the decision that I wanted to stay open because I saw too many kids and too many adults with asthma. The last place I wanted them to go was to the emergency room because they would be more susceptible to COVID-19 in the emergency room than if they came here into the office. You guys. It became personal because these essential workers could have been my family. My dad worked as a butcher his whole life, and my uncles are essential workers. My aunts were essential workers. My grandparents worked in the farmlands. So how could I close my doors to this community that needed so much help and guidance? It was like turning my back on my family.
24 years old. I'm from Chicago, Illinois. I've lived in Chicago pretty much all my life. Ever since I started working, it's like kind of been nonstop. Yesterday I had an 18-hour shift, and the day before that I had a 14-hour shift. I've worked as a cook and at factories, driving. When you have a lot of jobs, your schedules just always work, really. For me, it's really difficult to find a job that I can maybe do from home. I don't have the resources to have that setup that you need. That's not an option. I see that more as a privilege, really. I try not to stress myself about the virus, COVID, although it did impact me and my family like directly. That very first week I got hired at the dollar store, they let me do 2 doubles in a row. You know, and I'm used to, working, and my body's feeling like sore, like I had a headache, I feel sick, it was horrible. And I finally get home and I just get in my room and I just lay out like how I was dressed, everything, and I just knock out completely. Like my body was just so over it. Literally a couple days after that, my mom started up with a cough. That's when everything kind of like kicked in, like everything was kind of like started to become a little more real,
Some of the inequities that we saw in the brown and black communities were the lack in the workplace of PPE and social distancing, and even areas where they could hand sanitize or hand wash. A lot of them were told, well, if you want to keep your job, these are the conditions. We're not going to change them. This is your job. They have to make their paycheck so they could feed their families, feed maybe their parents, everyone else too. They had to, I believe in fear, work.
I don't know, like I knew COVID was a thing, but I wasn't really too afraid of it. For myself, really, more than anything, or anyone really. Once it hit my mom, it was like complete, total reality, like when she got hospitalized, man, that was crazy. Like it was Easter, it was Easter.
¿Dónde está la familia? ¿Listos para sus vacunas contra el flu? Vénganse conmigo. Muy bien. So I see her little son whose asthma I've been managing for at least 3 years. You got your flu shot. And this is the woman who's having horrible shortness of breath, wheezing. She's on oxygen at the hospital, and she calls me to help take care of her boys and her husband. How's work going? Good?
Good.
Awesome. How's everything been going at home?
Everything's fine.
Are you so proud of your mom?
I am. She beat it.
She beat it, right?
Yep.
Excellent. And you got your flu shot, mister.
Thank you.
Sin la doctora, sin la ayuda de la doctora, yo no sé qué hubiera sido de mí porque yo estaba peor.
So above all else, she's very, very grateful for Dr. Mora, and I appreciate it.
Thank you.
Like, I knew she was gonna overcome it. Like, she had to get over it. Like, I was more concerned about like what the medical bill was gonna look like, you know?
Communities of color definitely are at a disadvantage when it comes to obtaining the best health care possible in this country.
Entonces, pues agradecerles porque pues gracias a ellos tenemos los productos que nosotros tenemos que comer diariamente.
They've been working really, really hard so that everyone has food on their table and that they serve their clients with pride every single day. This is our chance to really bring these worlds together and say, these are the worlds that, saved us through this pandemic. They are our essential workers and our healthcare workers, and they need to be taken care of.